Good morning, listener. The program is the platform, the People's Parliament, and the Court of Public Opinion. We call it the People's Parliament. We call it the Court of Public Opinion. I'm your anchor this morning, Jemilat Olanwaju, saying good morning on the program. On our Words on Marble this morning, it is good to touch the lives of others, for that is the essence of life and living. This morning, we shall have as our guest a community development stakeholder, a philanthropist, and a youth leader in person of Engineer Nurudeen Adeyemi Balogun. Igbomina Mobile Clinic is in Felodun. Repodun is the coordinator of the program. I welcome you to the program, sir.
Thank you for having me. It's a pleasure being here with you, man.
Thank you, sir. May we know you, sir?
Oh, thank you. My name is Nurudeen, Engineer Nurudeen Adeyemi Balogun. I will consider myself a philanthropist, living in the United States of America. I was born in Lagos Island of Lagos, and with most of our parents of Igbomina descent, most of us were sent back to Kwara State for our schooling. So I did my primary school in Ludon Runastri Primary School, and I did most of my secondary school in GS Umara and Ilorin Grammar School, Government High School in Ilorin. So I did most of my school in Kwara State. I'm a trained professional engineer with many years of service in the automotive industry, particularly with Chrysler Corporation and Ford Motor Company. But these days, I work for a company that builds and launches rockets and help many companies and governments alike put satellites into space, into orbit, so that many of you can get your DSTVs and the rest of the satellite provided services that way. I'm driven and I'm passionate about causes directly impacting humanity, and this has led me to many non-profit organizations, mostly in the United States, that are actively working to help people back home, mostly in Kwara State. Many of us are used to or know organizations such as Kesang, Kwara State Association of Nigeria in the United States. I've done many of positive things here with medical missions and things like that. I've been fortunate to be a chairman of many organizing committees, and also I'm the current president of Omo Ibile Isia North America, as well as the president of Igbomina Community North America. That is who I am in a nutshell. Thank you.
A complete Kwaran and a complete Igbomina decent person.
Thank you.
Then you've been talking about community development and whatever things you have done on the part of humanity. What's your drive for? What is your drive for community development, and what's motivated you?
Thank you very much. Most of us get to where we are not by our own share willpower and good luck alone. We have many people that lend a helping hand to us to make us here, such as the famous saying that says it takes a village to raise a child. Therefore, I would like to think that when God has given one the opportunity to be able to give back, one should strive very hard to do such. And that's what motivates me, and that's what I'm passionate about. I'm driven mostly because I want to help humanity in the little way that I can. To whom much is given, much is expected. So that has led to me joining and being active and being participative in many non-profit organizations, such as I mentioned, Omo Ibile Isia North America, for example. In the organization, we've hired and paid for teachers, helping students in math, English, physics, chemistry, biology, and that has led to a resurgence of performance in Isia Community High School, and that has led to the a renewal of the UNESCO program, which is a very good program for the students, and the students and staff are benefiting greatly from that program. In addition to that, based on the little successes that school have enjoyed, we embarked on renovating school blocks and providing furnitures, desks and chairs for the students. And by the grace of God, the school block that was just a pipe dream for us a few months ago has now been completely renovated and handed over to the students. So for the next school session, the students will enjoy a very good brand new facility and not be having to study under very difficult condition with no roofs and bad ceilings and such that rain and adverse weather is affecting them. Also, you mentioned the Igbomina Mobile Clinic. Around 2014, we embarked on the.
We'll still get to that area.
Mobile clinic. Okay.
But I want to ask you where you get your funding from. Is it personal or you get international fund from somewhere?
No, most of our funding is private, personal. A lot of us dip into our pockets and do a lot of things. I'm glad that I have a lot of committed people. Doing what they can and making all these contributions. I believe in a community effort and trying to galvanize as much support for that. Yeah, so practically all of our funding right now is from individual donors and just private people trying to do good for the next person. Hopefully,
possibly people from Igbomina Access.
Yes, most of our funding right now comes from people in diaspora. Okay. We have support from the Igbomina Descendant Association of the United Kingdom, Igbomina Community North America members for most of our programs, and also the MIBLACE North America for some of the programs that we're backing on. So everybody is doing every little bit here and there, but when we bring all those resources together, it can mean it can make a world of difference. And that has been something that I'm very proud of, that one has been able to be a huge contributor to that and make all of those things happen and help our people.
It seems you have this Igbomina mobile, Igbomina in the UK. Do you have any synergy? It seems yours is in the US. So do you have any synergy?
Yes, we truly believe in Isokan Igbomina. Okay. So the Igbomina here on the ground in Nigeria, along with the Igbomina Descendant Association in UK, and in partnership with the Igbomina Community North America, we look for ways where we can all collaborate and help each other out and see how best to help our people. Our common goals and objectives, our goals and objectives are very common in that community service and helping the lots of our people and being an advocacy group for our people is one of the things that drives many of us. And I will be remiss to not mention the of a Descendant Union North America. They do very good work as well in terms of providing medical missions annually as well. I have a little bit of in me as well. Since my ancestral home also is Balogun Reafa of Offa. So I do the little bits I can to contribute to the Offa Descendant Union Association of North America as well.
You still have link with Offa?
Yes.
From Igbomina?
Yes.
How did that happen?
Well, it's a long story, but my family house in Isia is called Isale Offa. Okay. Meaning that our family originally came from Offa, with many families that travels all across Kwara South. Okay. So I am an Igbomina man with a very strong Offa ties. Okay. And my uncle is the patriarch of the Balogun family in Offa right now. And my dad is the current Balogun of ACA as well. So I have two homes, and I enjoy both of them, and they're all my family. And actually, I would probably say the entire Kwara South is all my families because I have many roots in many places.
Yeah, man of many parts. Then the same initiative, is it? Do you have a plan of moving it to Offa too? Since you have
God willing, one who never closes his mind has been challenged by the chief imam of Alpha to see what we can to make sure that this program is not localized only to the Gomina areas, that we do also for our brethren in the Balogun nation, as well as our brethren in the Ekiti nation. And God willing, we will try and see what we can to make sure that that becomes a reality in no distant future. If everything is about resources, obviously, and we're trying to do what we can with what we have right now. But like I said, God willing, we will look for ways to expand this program. Sustainability of such a very important and life-changing and life-impacting program is always something that one should strive for, and we will definitely keep working towards such.
That should be a charity news also some of our people, because you have one of your siblings here in the person of Ajara here. It's from your area, so I believe it's going to be a charity news to them. Then moving to another area, where have you really touched the lives of your people? Can you mention specific areas?
Yes, the Women Mobile Clinic it goes out twice a month, on the first Saturday of the month and the third Saturday of the month. And Women is mostly right now in Kwara State within 3 local government, Ifelodun local government, Irapodun local government, and Isin local government. So we try to kind of keep a balanced approach and rotate the program to each of the 3 local governments, and we try to visit both the big towns as well as the small towns. Most of the areas that really needed our help, at least from a healthcare point of view, are the small little towns and villages and hamlets. And we try to kind of do a grouping of maybe go to one area where we can serve about 3 or 4 towns at a go. And at any one outing, maybe we can reach about 3 or 4 major towns, meaning we are able to effectively touch about 12 towns. So it's a Igbo nation. It's got probably about 254 or so communities. So there's a big challenge to try and cover all of those in a very short period of time. But if it has not reached your area, please do not be despair. We are really working really hard to see what we can do to make sure that we touch your area very soon.
But what motivated you moving to hamlets and small towns? Why not?
Because for the most part, some of our big towns have hospitals, and they have cottage hospitals, whether level 1, level 2, or level 3, as the case may be. Some are functioning, and some may lack or have a little bit challenges here and there, but at least the people have some form of access. Most of the people that are grossly affected do not have access, and they are mostly in the rural areas, and that is why we are trying to focus our energy and time in those areas, particularly in those areas. But like this weekend, for example, I believe they are supposed to be going to Ajashe. Ajashe does have a health facility, but just take for like the Kara market in Ajashe, for example, you have many people that comes to that area from many small towns and villages that may be in Ajashe on that day and have access to use the mobile clinic. So even though we're in Ajashe, a lot of people from many rural areas have the opportunity to come, as we do not turn anybody away.
Okay, the mobile clinic now. The Women Mobile Clinic, what is it all about to achieve?
The Women Mobile Clinic cannot be all things to all people at all times. So the goals and objectives of the Women Mobile Clinic is really to provide a first line of defense for our people in terms of being able to give them primary health care, primarily in the areas of diabetes screening, high blood pressure screening, taking care of malaria and such, and some other things that may be afflicting our people. The most important thing is that we try to focus on the things that we can impact the most. These are some of the deadly diseases that can really kill people without people knowing. So it's just a way for us to be able to attend to a lot of people and let them know if they do have some of those manageable but deadly diseases that they may not be aware of. In many communities, you can have communities with as much as 40% patients being seen having high blood pressure, and many of them are not aware of the fact that they do have these deadly diseases. So those are all the things that
you
we're trying to
sensitize
work
them.
on. Yes. Thank you.
Recently, there's been this case of Lassa fever and whatever, and it's very deadly. Do you have any kind of program for people in this hamlet? They are the major focus recently with the government. What are you doing about it?
Oh, thank you very much. At the onset of the Lassa fever, for example, our field coordinators, led by Dr. M.O. Babalola, as well as Elder Oyin Zubar, and our project committee leader, Mr. Emmanuel Adeyemi, and as Vice Chairman, Honorable Alhaji Rahim Adedoyin. The mobile clinic staff got, and many of our volunteers got involved right away, went to the field, did some fact-finding and screening. And once the state came back that there's possible 1 or 2 cases of such being found, we launched a ad campaign trying to sensitize people to prevention and be going out to the field, playing those ad campaigns and handing out leaflets to kind of educate the people. And the mobile clinic vehicles has been crisscrossing almost the entire Kwara South, not even limited to Igomina area only. And I think outside of us, we cannot really, when you have such a deadly disease as Lassa fever, we probably can identify the symptoms and refer them to the necessary hospital that can take care of them. But our primary goals and objectives in terms of supporting the Lassa fever, potential Lassa fever outbreak, I don't know whether it's been confirmed yet or not. That is really
we have like 2 cases sometimes.
So exactly. So what we're trying to do is do prevention instead of curing by doing a lot of education analysis, and we, instead of just limiting it to the twice a month outreach that we were doing, we were routinely going out every day. Because we saw the importance of prevention in those areas.
How far have you achieved in terms of sensitizing people? And
I would say that in the areas that we've touched and in the areas that we've been able to visit, there's a lot of heightened awareness about the Lassa fever, potential for Lassa fever, and what they need to do to prevent it. So that would be probably a major factor in minimizing the spread of the Lassa fever. One major area that was very concerning to us was the Kara market in Ajashe that I mentioned a while ago, with many people coming from Lagos and everybody trying to buy Ilaya ram. We were afraid of the number of people congregating in a very small spot for the rapid transmission of such. So therefore, we doubled our effort in terms of prevention and education outreach in those areas. And I think it's yielded many positive results, as we have not heard of any major conflagration of any of those coming out from that area. So I would say we've positively impacted the trajectory of potential increase in those diseases.
The program is now in how many local government areas? And is there any hope of it being extended to cover more areas?
I mean, everything is about resources and focus. We're just a small group trying to do the best we can, the best way we know how to. So like I said, we've covered all of the Ibomina local government, all 3. And we've also made some outreach to offer as well. And we're working really hard to broaden it to Onyu, Okero, and Ekiti local government as well. But we've made a spot visit here and there, wherever the cases are. If we have any kind of Lassa fever case in any community restricted by boundary to say, okay, this is not an Ibomina area, don't go there. I think we've made a very conscious effort and decision to go to any of those areas that we think may have been affected and do proper education and sensitization.
Then do you have any other projects in sight apart from the mobile clinic?
We're always looking for projects that we can positively impact, that can make changes in people's life, and such is the education area. Like I said, we hired and we're paying continuously for about 4 teachers or so to help our students achieve and do better. And also talking about the renovation of the school buildings as well. And we're also looking for ways to help the libraries, help the computer labs, and things of that nature. But some of those things can be very difficult due to security challenges, because in the past we may have helped equip the laboratories in some of those schools, and only to see it being boggled and things stolen. So some of these things have to be done in phases, make sure that the security of what we've provided is there, and then we can see what we can add to it. So those are all some of the things that we're looking at, and one cannot never leave behind the entrepreneurship training and skills that one is trying to help with our students, because we do really need to prepare them for the reality of life, not only just going to classroom and studying, but also for them to know that there's more to life and more to school than just school. We have to teach them what I call education of life, so they are well-rounded students, and when they graduate, they are not going from offices to offices with their CVs looking for job. If one does not come to you, you can make something out of yourself with your own handwork. Learn some skills, learn some trade, and make yourself employable, or make yourself employer of men and women alike.
Then, if I may ask, you are based in the United States.
Yes.
But the project is here in Nigeria.
Yes.
How do you coordinate activities from there?
Well, that, like you said, I'm a man of many things going on at one time, and when you have such a project, you need many good people on the ground to make sure that it's coordinated very well. But we just provide guidance and oversee things, and spending many hours on conference calls and phone calls to make sure that the task on hand is ongoing and stay in constant communication. With this day and age, the world is relatively small, with the communication gap very shrinking rapidly. So therefore, we are blessed to have very good people on the ground, like I mentioned, that are actively working to make sure that the coordination and efforts that need to go into some of these things are really working. As I mentioned, we have Dr. Musbao Olasukambabalola as the head of the medical team, coordinating most of our medical efforts.
In Nigeria?
Yes, with many volunteers, most of them of Igbominà descent, and also many of the local governments are lending a helping hand by providing us with nurses and things when we go on many of the outreach.
Do they get any compensation for doing this?
No, I mean they work for the government, and what we do is generally when people volunteer, we don't really pay them salaries, but we give them some form of a stipend during the day, because we can never really repay them for the time and effort that they are putting in. It's tough to give up your weekends, because most of people work very hard Monday to Friday, and now you're telling them to give up a Saturday that they should be spending with their families or doing their own personal business to come out and do some of these things. So they are really
work only on weekends.
Yes, for the outreach, because we do rely on volunteers, doctors, and nurses, and pharmacists. So is the weekend is the best time, so that we don't adversely affect their professional lives. And like I said, we pay them stipends and such. But it's not enough to compensate them. It's just a kind of a token thank you. The coordination, such as the Elder Onyezubar, Mr. Emmanuel Adewi, Honorable Rahim Adedoyin, Chief J. Ogundele, many of the people on the project committee, and with the good support of Egbeomo Ibile Egbomina and many of our royal fathers as well. They have been very supportive of these programs. The coordination of going out to their towns and coming to their areas, they welcome the team most of the times, give them very good hospitality, food, drinks, and things like that, just to appreciate them for the time and effort that they're putting in. This program is probably a very good model for our community. When we talk about the Sokon Egbomina, it's been something that is been really working well well because many people are talking to many other people, and that allow us to be able to dialogue and achieve the next phase of development in Kwara South.
Where do you have your headquarters?
Well, our headquarters is we have a national headquarters in the United States. Locally, we are trying to operate on a shoestring budget, so we really do not have a permanent home, and we are still looking for one. Probably somewhere in Gama or Amoyo. Okay. To be able to put something there because of the relative closeness to Ilorin and to Kwara South, so that we can have many of our volunteers easy access to those areas.
Exactly, so, because of access. That was why I asked.
Yeah. So that is why we're looking at somewhere in Amoyo or so to have a permanent home. But right now we're just trying to minimize our budgetary spend by trying to do a lot of things on a shoestring budget, but it's been working very well so far. But anybody that needs to get hold of us knows how to get hold of us, either through phones or
possibly email. You give the number before you leave, or what?
Yes, I mean right down the vehicle is our email address, is right there, and also our Facebook page is right there. So any comments or anything that comes to us, we react very, very quickly to within a day or two.
Okay. Then, well, what is your advice to other well-to-do individuals in the country as regards this philanthropic moves that you're making?
Thank you. Hopefully, other people that have the opportunity that I've been blessed with are able to, in one way or the other, contribute to their own community and to society by giving back in one way. I think the mobile clinic that we have here is like probably one of a kind, at least in this side of town. Country. And hopefully other communities and other well-to-do people can replicate such.
Because we have so many of them, but maybe they don't even know where to channel their wealth,
Exactly. Exactly. And sometimes many people have money and they don't know where to even begin. Yeah. And some people have ideas and they don't even have a way to access those wealth. What I would say is many people are doing good things.
You can start from their community. Exactly. As you've done.
Even if you cannot start something yourself, you can identify one or two people that are doing many good things and see how you can help them. A very good one is the young man Kayode Onyuzuba, which is initiative of repairing and boreholes across the state. Okay. He has done a lot of good work in Kwara South, for example. And one has tried to pair him up with many people of like minds, and a lot of people in diaspora, particularly myself as well. I've tried to support the initiative financially to make sure that the people on the ground can get the benefit of water, clean water. So those are some of the things that one can do. So there's many opportunities abound. Fresh Insight is there by the young man Abdurrashid Akogun of Fresh Insight Foundation, providing kits to students, uniforms and school kits.
Is he an women man too?
Yeah, he's an Igwomina man, but his activity is not restricted to Igwomina alone. It's all over Kwara State, both Kwara North, Kwara Central, and Kwara South as well. So there are many of those young people doing many good things that one can tap into and support them financially. To see how those things can be more in more communities. So even if you are blessed materially and you cannot start something, you can always find other people doing things that you can support, and they will give you the due recognition that you deserve, because they are not shy to hide who are the people contributing or making donations. Because I understand in this climate, many people would like to have their names mentioned as contributing positively to many of these things, so that at least people can know that they are not just doing something, that they're actually making waves within their own community. So this young man, as mentioned, and some of the young women that I know are not bashful about making sure that people are duly recognized for their support. Thank you.
The program is the platform, the People's Parliament, and the Court of Public Opinion. If you are joining us, we have a guest in the studio, is a community development stakeholder, a philanthropist, and a youth leader in person of Engineer Nurudeen Adeyemi Balogun. Is one of the coordinators of the Igbomina Mobile Clinic in Felodun Rekpodun. Am I right?
Yes, ma'am.
Yeah. So
the initiator and the sponsor.
The initiator and the sponsor of